Welcome to today's news briefing, co-hosted by the California Department of Aging. I'm Sandy Close, Director of Ethnic Media Services, and your moderator today. We're focusing on vaccinating those people who are most at risk and hardest to reach: elderly people, people with disabilities. Some 25% of people 65 years or older have not been vaccinated. For those who are isolated because they live alone, are not mobile, or do not speak English fluently, or can't access the internet, the number of unvaccinated people is probably higher. We also know this is the group that suffered the highest fatalities from COVID-19. This briefing is a call to action to make sure this population does not get left behind. Our speakers will explore the challenges isolated elders and people with disabilities face in accessing vaccines and the urgent need for high-touch community programs to reach them. Kim McCoy-Wade, Director of the California Department of Aging, will provide our opening remarks. We will then hear from Dr. Louise Aronson, a professor of medicine at UCSF and an expert on aging issues. Annie Chung, Executive Director of Self-Help for the Elderly and a member of the state's Commission on Aging. Cindy Cox-Roman, CEO of Help Age USA, a global nonprofit, and Jessica Lehman, Executive Director of Senior and Disability Action in the East Bay. We ask our presenters to speak slowly for our interpreters. If you speak too fast, I may interrupt to ask you to slow down. Reporters, please enter your questions in the chat box. We will take questions after each speaker, if time allows, also at the conclusion of the conference. After the briefing, we will send a video and expanded biographies of our speakers, along with relevant collateral. So we begin today's briefing with Director Kim McCoy-Wade. Please take it away, Ms. Wade.
Thank you, Sandy, and thank you to all of you for coming together. All of us here know that while California is coming back, we are not done. We are far from it. As the Director of Aging and work daily with older adults, people with disabilities, and their caregivers, we are still in the midst of this, and that's why I'm so glad we have this incredible panel and all of you here. So I will be very brief about why we are laser focused on the issue of older adults and vaccination. About a month ago, we saw some preliminary data at the state that was shocking to, I think, all of us, even though we knew there are different barriers, different opportunities in different communities. While we're showing that statewide, more than 75%, 3 out of 4 of older adults 65 and over have gotten a vaccine, the rates vary across race and ethnicities and across communities. So at our preliminary state data look about a month ago, the number that most jumped out to me was the vaccination rate for Latinos 60 and over was around 40%. Half of what the state is tracking for white and Asian American elders, and strikingly lower than Latinos in their 50s, which is the only racial group where we see 60s lower than 50s. And then of course, 70s and 80s is even lower than 60s, when we know that those are even higher risk of the worst outcome from COVID, of course, losing your life. So that gap in Latino, and again, we saw a similar, not quite as bad, but if 80% is where white and Asian Californians over 65, the vaccination rate, and Latino was at 40%, Black and Native American elders were at about 60%. So we've got gaps by race and ethnicity, we've got gaps by age, and we undoubtedly have gaps by community, as we'll hear from our panel as well. So what are we doing about it? We're gathering here today. We've done a couple things. I think first, we have tried to make it easier logistically to get to the vaccine, push out from these mega sites to community sites, offer free transportation, offer phone lines, not just online sign up, offer drop-in without appointment. So we're trying to make it easier and getting the word out that it's easier than ever to find a vaccine as part of our message. The other piece is we know people have questions. Who wouldn't? And we're trying to make it easier for people to get those answers. So you have community groups getting outreach grants from the state so they can hear it from their community leaders and partners that they've worked with, maybe on the census or on voter turnout or on disaster preparedness. The same messengers can bring the vaccine. And of course, our all-star team at the state, our Surgeon General, Dr. Burke Harris, has done a lot of town halls with the African American community. Our public health director, Dr. Thomas Aragon, has reached out a lot with the Latino community, and our chief epidemiologist, Dr. Eric Capon, has done a lot of work with the API community. So we continue to try to be there to answer people's questions about this unprecedented vaccine. And then thirdly, of course, you've heard the governor's new strategy to make it even more tempting to come get your vaccine with the gift cards and the chance to win big in the lottery. So we're trying a lot of things, but I think at the end of the day, we know what you know, which is that people need to hear information where they are from people they trust, and that's all of you, whether they're already reading your paper or their family member is reading your paper or listening to your radio show. We know that when people hear it from their grandkids, when they hear it from their faith leader, when they hear it from their best friend, that's when they go ahead and get the shot. So we're so grateful that all of you are here to hear from this panel of experts with their best thinking, and that you will help us give people that information they need to answer their questions, build that trust, and easily connect with the shot near them, and maybe win some money in the process. But most of all, get us to the immunity that they need to save their lives, and we all need to have a true, equitable California comeback. So with that, I'll hand it back to you, Sandy, and just gratitude again for the group you've gathered here today.
We'll be on the call for questions after our first speaker. Great. So we go now to Dr. Louise Aronson of UCSF School of Medicine, a nationally known expert on aging issues and author of the book Elderhood. Dr. Aronson, thank you for joining us today.
It is a pleasure to be here. This is a great opportunity, I think, for all of us. Director McCoy-Wade just discussed why, because there are these big differences. And actually, there's some other differences in who's getting vaccines. It's not just that the older you are and which community and what part of the state you live in that makes a difference. It actually turns out that healthier older people are more likely to get vaccinated than less healthy older people, even though the less healthy people are the people most likely to get serious illness, to require hospitalization, and to die. I want to step back for a minute before I continue to kind of talk about why. Why are older people at much higher risk? Sometimes people don't even ask that question because we so associate old age, and I should actually also say disability, because you can gain disabilities with age, but you can have disabilities from birth. So people who are old and people with disabilities are often in similar categories. They are different, but there's some overlap there. Why are they at higher risk, and why do we need to ask that question? When we don't ask that question, we assume that the only problem is biology, that these people are very old or very weak, and that's just the way it is. Now we've known forever across civilizations and time that we can make things better for people who have somewhat higher risk biologically, old people and people with disabilities, and we can make things worse. So in this pandemic, for instance, about 4% of American old people live in facilities, nursing homes, assisted living facilities, but they accounted for, across the country, 34% of deaths. Now, you might say they are the oldest and the frailest, but what is also true true is that in many states, they took old people who lived in the community who got COVID. Most old people, 96% of old people live in our communities. Those people got sick, and they were so sick that they couldn't go home. So what did they do? They sent them to nursing homes and assisted living facilities with their COVID. So they took people with COVID and put them in the facilities with the people at highest risk. At the same time, they did not provide those facilities with the ability to test or with the equipment to protect the people who worked and lived there. That also meant that the sort of people who work in those facilities took the disease back to their communities, usually low-income communities of color. So yes, there is a higher biological risk with age and with disability, and we can be part of the problem or part of the solution as a society. So what about homebound elders? Well, we don't have a really good nationwide system for them, right? Because already we don't really see older people. In fact, when we think of somebody as visible, they're often not counted as old. If someone functions well, then we say, oh, well, they're older, but they're not really old. But at some point, they're actually old. But if you also don't come out of your house, then we really don't see you. And if you're an older person of color in your home, then you're at least triply invisible. So these people are more often left behind. It's harder for them to communicate with others and to receive communication. That's why you all are so important. They're harder to reach by the strategies that counties, the state, and the federal government are using. Most of those strategies rely on the internet. And we know the three communities least likely to have access to internet are the oldest people, the people in rural areas, and people with English as a second language, immigrants and other people, particularly if they are low income. So when all the strategies are digital, we're again adding to the problem and to the risk. Also, and we just heard about this, but many of the initial efforts were at big sites. So if we've been telling you for 15 months that you're at such high risk, you don't want to be around other people, and then we tell you to go get your vaccine at a place where there are lots of other people, you're going to think, I can't believe these people, Also, if you're homebound, how are you going to get there? And I want to say also that homebound there is really broad. There are people who literally can't leave their house. There are people who can leave their house only with great difficulty. And I know from my own patients that many went to sites and found long lines and no chairs. So this was in the early times where they were saying, who are we vaccinating? We're vaccinating older people. But the people setting these things up, it didn't occur to them to provide seating. And this speaks to the other big problem. Our public health systems don't have much knowledge of old age. If you look on the websites for the county, the state, the federal government. Now, I will say California does better than many for this at the state level, but usually you will see here's information about COVID, and here's some special information for children. And that's what we're also seeing now, get your child vaccinated. And obviously that's important, but you can also get your parent or your grandparent vaccinated, or your friend or relative with a disability. So what can you all do? Make sure you have accurate information. We've also had some trouble collecting information. Maybe within your communities, you could help to collect stories. That enables the government to put more resources. They put resources in places where there's noise, where there's action, where there's need. And this is a population that by definition doesn't make too much noise. So think about answering people's questions. What are their concerns? I've heard from patients different things, such as they're going to put a chip in me that's going to track my every movement, which if you come from certain countries, well, I think if you come from any country, you're not going to want that, but from certain countries, you'll be more worried. A lot of my patients who have illnesses think that's a reason not to get the vaccine. Whereas in fact, the opposite is true. And if you can get that one message across, that would be a huge help. The older you are, the more medical problems you have. If you are disabled, these are the three best reasons to get a vaccination. Contact your health department. Health departments are getting to homebound elders by partnering with area agencies on aging, by partnering with fire departments, with in-home supportive services, with Meals on Wheels, with many other community organizations. And in fact, that is the perfect note for me to stop and turn over to your next speaker to hear how that's actually working.
Thank you so much, Dr. Aronson. We have a couple of questions. I believe Sunita Sarabji, you have a question probably for Kim Wade and also for Dr. Aronson. Do you want to ask your question?
Absolutely. Thank you, Sandy. My question to both of you is,
Can you put up your volume, Sunita? We can't hear you. Sunita,
can't hear you.
Can't hear you at all.
Can you type in your question on the chat? Let me ask a key question. I think, is there a sense, Dr. Aronson, that out of sight, out of mind, are we looking at an implicit bias against others?
Yes, I believe we are. And there's some evidence for that, including last May when our governor wanted to cut services to homebound elders and people with disabilities. Now, this was reversed and he's done better since then. But sometimes people think, oh, well, we don't want to have contact with these people, so we'll just stop paying for this service, or we're going to prioritize somebody else. In fact, one of my favorite or least favorite headlines of this past year was in Time magazine, which used to be sort of the most read magazine in this country, not so much anymore, but it was, can targeted lockdowns for seniors help the US reopen? So what it did was it literally pitted, and I think the words US, so in English, US is also, if you say it, it's us. So there's us and there's the old people, as if we won't all become old people, you know, and people with some disabilities in our lifetimes. So often, you know, people think, well, you don't elect me, or I can't see you, so you're not a problem. And that's why media is so important in raising the voices and the stories of all these people who are our loved ones and our future selves also. We can create the world we want to grow old in.
Thank you. Here is Sunita's question via the chat, and it's for Kim Wade and Dr. Aronson. Is there an effort to leverage teenagers getting vaccines to encourage them to bring in their grandparents? Is there an intergenerational bridge that you're taking advantage of? Maybe Ms. Wade.
There have been, as teens have become more and more eligible in the last few months, there have been, I have heard anecdotally of some efforts, and I have seen my partners in the public health department launch a campaign with Native American communities, making that explicit grandchildren to grandparent connection. Come to your vaccine and bring your grandma or your grandpa. So we have seen some of those happen, and I'd love to hear the panel if they've seen those work.
Great. And we have a question for Dr. Aronson from Trang Nguyen. Trang, do you want to ask your question? If not, and in the interest of time, I'll just summarize what's in the chat. Dr. Aronson, a Napa woman who was an elder, older than 65, tested positive for the B117 variant after getting fully vaccinated, and she died on June 2nd. So knowing that vaccines won't be 100% effective, nonetheless, is this case the kind of causing doubt and making it that much more difficult to convince elders to get vaccinated?
Yes, and I think this is where you all play such an important role. So this is one person. We have vaccinated tens of millions of older people, and they were dying at the rates of many thousands every day. And now we're talking about one woman, right? So it's not perfect, and it is so much better than not being vaccinated. We've all heard the horror stories in nursing homes, but after they had begun vaccination, they hadn't even vaccinated everybody. The levels, if you looked at the graph, the levels were up here, and then literally just with starting the vaccination, it just plummeted, right? I'm taking my finger out of the screen, literally off the chart. So will this keep happening? Yes. And I would ask all of you to mention it and always add to it, and most people are staying alive, not requiring hospitalization or intensive care. And in fact, the majority of vaccinated older people who now get COVID don't even have symptoms. We're finding them on routine testing. It is actually, if anyone you're speaking to has had any other vaccine, these COVID vaccines, particularly most of these COVID vaccines are better. They're more effective than almost any other vaccine we've ever had for anything else. And that's the message I'd love you to emphasize, because that is the truth.
Thank you. We have some very fascinating comments on the chat relating to Sunita's question, her idea, also from our Russian media, saying that across all age groups in the Russian community, there's real fear of vaccinations. So just calling that out. Now I'm going to go to our next speaker, Annie Chung, who is Executive Director of Self-Help for the Elderly and a member of the California Commission on Aging. Ms. Chung, thank you so much for joining us today.
Good morning, everyone. And thank you, Sandy, Kim. Thank you, Dr. Aronson. I'd like to bring you with me to all of our outreach visits, because everything that you said just resonate with what we are trying to do. And Kim, thank you so much for really highlighting that a lot of the seniors that are not vaccinated really tell us all the time, all of the reasons that Dr. Aronson told us. There was so much misinformation, particularly for the limited English community. You know, they hear something, they pass it on, and then the children started to call our seniors and say, don't go get the vaccines. It should be the other way around. So Sandy asked me to talk a little bit about what we try to do to at least vaccinate the most vulnerable population. So back in about December, January, when vaccines were starting to be available, we already, Kim, just like you said, we knew then that the limited English speaking, the monolingual, the immigrant, and the low-income communities where our seniors really reside could not navigate that appointment system, right? I remember a lot of the grandchildren were hovering over their computer for 6 to 8 hours in order to get 2 appointments for their grandparents. So if you are a senior and that have nobody, you know, to do that for you, you're at the mercy waiting for something to happen. So we very quickly, we meaning our community, particularly self-help, we are the agency that provide a lot of support services for our seniors. So we went to the Department of Health right away and start to tell them, you know, you got to find other alternative ways to get vaccines out to the seniors where they need them, not waiting for the seniors to come get the vaccines, because it would take many months. So by about February and March, we started to hear that the local Department of Health, which is really a great partner with us right now, when they listen to the community, something will always happen. And that's when they started to approve clinics, PCPs, primary care doctors, to have the vaccines available at places where the seniors are more comfortable, just like Dr. Aronson said. When they go to massive vaccination site, our seniors would just get very lost and they would be afraid to go back. So at Self-Help, working with our community doctors, we brought the vaccines to our senior centers where we were passing out the nutritious congregate meals, no indoor dining yet. But 7 of our centers were reaching about 1,500 elderly every day. And that's where we vaccinate our seniors during February and March. So starting in April, we start to hear that there's a zip code in Chinatown, San Francisco, Chinatown, that has the lowest vaccination rate. And this is 94133. So our community got together working with the Nichols Chinese Coalition, the YMCA, the Chinatown CDC, Self-Help Chinese Hospital, the Chinese Healthcare Doctors Association. We work together as a team to make visits to the SRO buildings, right? The single hotel rooms with congregate housing. And we're just very fortunate that there's no major outbreaks in Chinatown. Because early on, our seniors are starting to wear masks pretty early on. And there have been a lot of advocacy and education and outreach, almost door to door, Sandy, that we have to do, because these residents are unlikely to also pick up the phones and answer calls from the official government parties. So the community really have to step in big time to provide that support, answering all the questions, right? Dr. Aronson, all these, they're injecting the virus into me. I don't want it. They're injecting something in me that track my movement. I don't want it. The vaccines were developed so quickly. I don't trust it, and so on and so forth. So we put a site together, a website that have the Q&As that answer all of these questions that people throw at us as to reasons why they don't want vaccinate in order to get them to vaccinate. So we have been doing that, and the 1,000 people in this one zip code about 6 weeks ago that were identified through intensive phone calling, making visits to these buildings, canvassing, talking to the children, right, who asked them not to, but now we say there's information that you should read up that we could provide you, and coming to the trusted doctors, partners are the doctors who ask our seniors to please vaccinate in order to protect themselves, their family, and the community. And it's starting to work. So lately, I think that the number 998 in this one zip code was lowered by quite a bit because we've been pretty much trying to outreach to every one of these 1,000 people. And I think that by now, most of the people have been vaccinated, except the last 20% that just, no matter what you say, they're just very obstinate and kind of stubborn about it. But we're not giving up on them. So Self-Help pivoted in May to a homebound senior. Just like our speaker said, the bedbound, homebound, the most vulnerable, they seem to don't have a voice, right? People forget about them. And we, being the agencies that provide services to elderly, have to, again, step up and rally the community. So on May the 15th, we went out with 14 doctors, 10 volunteer drivers, and 10 social workers, bilingual. And the team will go out to about 130 homebound seniors, homes to vaccinate. You should see the smiles on the seniors and their families' face. The oldest patient, actually, that was on my route, was a 107-year-old. And it is so special. So Sandy asked me that if we could interview, Dr. Ng, he's an acupuncturist and very proud to be getting the vaccine. So we're gonna do that to let other seniors know that vaccines really work. And the older you are, the more important it is for you to get vaccinated. So I want to stop and thank Sandy and really all our ethnic media partners. You are the ones that get our stories and our messages out. And even if we are willing to do the work, you know, we need media partners to let the seniors that are very isolated know that there's someone that loves them, care about them, and will go the last mile in order to help them get vaccinated. So this Saturday, we're going back for the second dose. And then in another weekend, I think that we're going to go out to the Sunset, which was identified to have at least 2,000 seniors that are not vaccinated. And this is where Sandy and I live. So we have to roll up our sleeves, go out, and tell our other senior stories to hope that we could attract. We're going to even raise some money so that we could follow Governor Newsom's example to have a small raffle, not $1 million, that maybe $500, but also have some giveaway items to attract the people to come to our tent and our table. And we're collaborating that project with the AAMG doctors and the Walgreens, so that Walgreens could give them the vaccinations right away. So I'm gonna stop and just share with you a quote that I've been asking all my staff to remember it. And it was from Winston Churchill. And he said something like, during the peak of the wartime, he said, it is no use saying we're trying our best, but you just got to succeed in what you are doing, what is necessary. So I take it that we are all trying our best, but sometimes taking care of our most vulnerable seniors, trying our best is still not good enough. And we have to do whatever it takes to get all of our seniors vaccinated. So thank you very much, Sandy, for doing this webinar today.
Thank you. This is really the first step, Ms. Chung, in building our own expertise in this field. And I think most of us realize we are a critical bridge to ensure that no one gets left behind. We have a question in the chat from Jorge Macias. Jorge, do you want to ask your question very briefly? And it can go to either Ms. Wade or Dr. Aronson or Ms. Chung.
Yes, good morning, Sandy, good morning, everybody. I have two questions in one. Here in Los Angeles County, officers, Los Angeles County Sheriff Department were providing the vaccine directly in places, in homes, or with medical clinics where they have people, adults who are in the greatest need. They were vaccinated in those community clinics, and the plan of this program, it was a success. The Sheriff of Los Angeles offered this program to the Los Angeles County Board of Supervisors, and because of the political fight between them, the Board of Supervisors did not wanted to implement this program, that it wasn't successful. So my questions.
Jorge, we're losing you. Can you just very quickly ask your question?
Okay, perfecto. Okay, la pregunta es, ¿por qué es tan difícil para el Estado ir a donde los adultos que tienen necesidades especiales
It's a very
no han sido vacunados? Y la
Right.
pregunta es, ¿por
Okay.
qué para el Estado y para las autoridades de salud?
Let me just quickly interpret.
Sí, señor.
The question is, and maybe this goes to Ms. Wade. Why?
Right. My questions are, why the state is not going directly to vaccinate the adults who are handicapped, and they don't have the
Yes, and
to go.
Okay, Jorge, let's let Ms. Wade answer, and then we have one other question. Wait,
Yes, and the answer is that as of May, the state is doing that in partnership with each local public health jurisdiction. So you can call the My Turn phone number and request an in-home vaccination, and My Turn will connect you with your local public health department, who is working with the firefighters, with the ambulance teams, with all public health nurses to come out. So anybody who is at home because of limited mobility or increased risk and needs an in-home vaccination should be able to get one by calling the My Turn 1-800 number, and they will help you book it. Now, your healthcare provider may, there are other ways to do it too, but the state wanted to provide that backstop. So no matter what a county decision was or a health plan decision was, you could always call that 1-800 number. And through the partnership with the state, public health, and your local, really your ambulance service, they will send a team out to do that. So there's many, the good and bad news about this vaccine effort is it's been a kind of a potluck. There are so many different things happening all over the ground, which is wonderful. And it's in the way the communities are coming together, but we recognize it can also be a challenge to navigate. So My Turn is supposed to be that kind of backstop to help you navigate, but often it will then be connecting you down with that local community group, that local city response to make sure someone can get to your home. And just quickly, Sandy, I'll also say the same is true for transportation. If the only barrier is the transportation to a site, you can also call My Turn, and either they will help you with your Medicaid health coverage transportation, or they will book a ride for you. So transportation and in-home, My Turn is a place you can call on the phone, and they will solve that problem with you and for you.
could you, Ms. Wade, just repeat the phone number?
Yes, thanks to my partner in crime here, Connie Nakano. I just put it in the chat, 1-833-422-4255. You can also do it on the website. They'll ask you to check a box if you need it in-home or transportation, but what will happen is you'll get a real life phone call back from a human being who will talk to you and arrange whether you need transportation or in-home. So you can also call direct 1-833-422-4255. And that really is in the last month. It's a new service. So thank you for helping get the word out about that.
And can they ask what language they want the call back in?
Yes, yes,
Right.
yes. And a language line interpreter will be connected to do that. It'll be a three-way call once it's beyond Spanish. Yeah.
Terrific. In the interest of time, we have some very good questions in the chat. Perhaps our speakers would be inclined to respond, and then we'll try to come back to those questions. But I want to go now to Cindy Cox-Roman, who is our next speaker and who has an agency that actually advocates for elder people in developing countries, and now increasingly among diaspora populations here in the United States. Ms. Cox-Roman, please take it away.
Thank you so much, Sandy. Appreciate it. And Jessica, if you could please begin the slides. I'm going to share from our research presentation. Let me know if you can go ahead and do that.
Just Cindy, I should have said you're the executive director of Help Age USA, which is a global nonprofit. So
thank you so much, Sandy. Welcome this opportunity to share the findings of our research on older, low-income Black adults due to COVID-19's disproportionate impact on older people of color. We have broadened our focus to include the diaspora in the US, and pleased to be here talking to ethnic media to strengthen connections to ethnic communities in the US. Next slide, please. Objectives and method. Why this research? As we know, Black adults have been very hard hit by COVID-19. We've talked about the fact that so much has happened online, including research, and there's been a great amount of research about vaccine attitudes, but the views of older, low-income Black adults are not typically represented on online panels. We really wanted to make sure their voices did not go unheard so that public health officials and community leaders can incorporate those voices into strategies to meet their need. So we conducted what's called qualitative research. Over the past few months, we talked to 32 older Black adults with an average age of 70 across the country, but concentrated in Washington, D.C., the Atlanta area, the Chicago area, Contra Costa County, and Mississippi. So this reflects the range of opinions that we heard. Next slide, please. This slide illustrates the widely divergent views among older Blacks about the vaccine during the course of our interviewing. If you look at the rejectors on the left-hand side, this is a group, and a small group, of older Black adults who see medical abuses going back to slave ships as cautionary tales. On the right-hand side, the believers are completely different. They see a link between the past and the present as problematic and believe in the science, and the COVID-19 vaccine is safe for them. The important group on here, well, they're all of course important, but an important group to understand is the wait and see. They are somewhat like the rejectors in that they have some concerns, see a connective tissue between what happened in the past and now, but their primary concern is more about side effects and concerns about reactions to medications, et cetera. During the course of the interviewing, which took place from January through April, we did recontact interviews with people who were wait and see, and we learned that most of them had since gotten the vaccine. Why did they move to the right? Not because they believe in the science overnight, they're not overnight believers, but for pragmatic reasons. Access is huge. One man talked about the vaccine being available in the lobby of his building, and that changed his mind from being hesitant to getting it. Some have seen their doctors, which play an incredible role in helping older adults make a good decision for themselves, but they weren't necessarily seeing their doctors during the pandemic. They have seen friends and family who in their age cohort have gotten the vaccine and haven't grown a third limb or had other side effects. And certainly as an older person, they realize that they are more vulnerable and they don't want to die. Next slide, please. What are the forces at work or the dynamics that have been impacting or influencing the views of these older Black adults during this time? Imperfect information is a key theme. Some are frustrated by conflicting information or gaps, hearing one thing on TV and reading something different online. One woman pre-pandemic relied on information about health from her local senior center, but when the senior center closed during the pandemic, she lost her trusted source of information. Internet access again and again is a big problem since so much of the information rollout has been online starting back in December and January. As one man in Georgia said, we are the lost generation of the information age. Next slide, please. A lack of family information sharing. It's very interesting to hear all the comments about grandchildren and other people helping, and certainly that can and has been a factor. But it was a very interesting insight from our research that families weren't necessarily talking to each other. In an ideal world, they're sharing of accurate information between the generations, but few of the people we interviewed had talked to their adult children or grandchildren about the vaccine for various reasons. An aversion to crossing boundaries, that's their body. I'm not going to tell them what to do. Denial about illness is a factor. Some were angry that younger family members or siblings their age, and once again, the people we interviewed were, average age of 70, but in at least one case, somebody we talked to, her brother had brought it into their home. Her niece was in the hospital, and she didn't know about it. There was sort of embarrassment that he had brought it into the home and anger on her part for acting irresponsibly. When discussions about COVID-19 and the vaccine do take place, they can be tense for all the reasons we've heard about rolling out across the country when people have different views. Next slide, please. Inequitable healthcare system. For the older Black adults that we talk to, fear and distrust of the healthcare system can play into it in different ways. One woman said the expectation of substandard care motivated her to get the vaccine. She does not want to get the virus because if hospitalized, she knows that as a Black woman, she is more likely to die. And one man was asked if there was anyone he trusted to give him good information about the vaccine. And he said, it's not about trust. It's about my options and my choices. Personal physicians are the exception due to the personal relationships that have developed over time. And a number of these older adults talked about how they perceived that their doctor had genuine interest to them, even before the pandemic, reaching out to them, et cetera. So there's a lot of trust there in general. Next slide, please. And last but not at all least is access barriers. You have to remember, we started doing this interviewing back in January when things were first rolling out. And we found that for those who want to get the vaccine, access can be challenging and puts them at the mercy of intermediaries. And nobody, no matter their age, wants to be at the mercy of someone else. Tech barriers mean relying on children and neighbors. One woman was upset because her dialysis center, she felt they were not advocating hard enough for her and other high-risk patients to get the vaccine. But she saw on TV that there were long lines. And as somebody spoke about earlier, she realized that she could not wait in a long line like she saw on TV. And it can be very frustrating for these adults that others who are more affluent, other older adults, have been getting the vaccine more easily than them. One woman said, we are not reluctant, they are just not available. Another man did not want to go to get a vaccine at a distribution site far away from his home because he was concerned about his reaction coming home on public transportation. Next slide, please. This was part of a larger research presentation, but just to leave you with some thoughts about the path forward, based on Kaiser Family Foundation COVID-19 vaccine monitor data, this is actually going back to April, is the latest that we found, but older Black adults are getting vaccinated at the same rate as older white adults. So all of the activities that are taking place are clearly making a difference. But whether it's for the booster shot or the next pandemic, there are a number of steps that must be taken. We must make sure that vaccine sites are easily accessible to all because of the multiple ways in which it facilitates. Personal doctors must be empowered to do outreach about the vaccine. Older Black adults trust their doctors to give them good advice. Improvements must be made in how information is disseminated, the quality of that information, and it must be still ongoing to help older people take care of themselves. Rising vaccine rates among Black adults should be broadly communicated because hearing about hesitancy can reinforce hesitancy. Hearing about rising vaccine rates can encourage and reassure. And finally, bigger issues, strategies should be shared to help Black families talk more easily among themselves about health issues, including COVID-19 and the vaccine. And so I'm getting unstable internet connection. Older adults must be empowered through technology skill development so they are not at the mercy of intermediaries. And Black adults must be engaged in co-developing strategies to address healthcare disparities within communities. Thank you very much.
Thank you. And that's actually fascinating research, which we will share with all the attendees who joined us today. I'm going to go directly to our next speaker and then leave the remaining minutes we have for questions for all our speakers. And sorry that time runs so quickly when the information is so important. Our final speaker is Jessica Lehman, who is a disability rights advocate in the East Bay with Senior and Disability Action. Ms. Lehman, thank you for joining us.
Thank you so much for having me. I'm really honored to be here with these incredible speakers and so many reporters really doing great work in your communities. I have a lot to say, so if one of our hosts could let me know when I have about a minute left, that would be really helpful. So there's so much. So to start with, I wanted to add on to some of the information that Dr. Aronson mentioned about how so many people died in nursing homes, right? We've heard this, but the latest figures are that nearly 1 in 10 people in nursing facilities died of COVID. And if we're looking at long-term care facilities broadly, it's nearly 1 in 12. And that partly gets at the question that Jorge Macias raised about why are we not vaccinating people with disabilities who are in facilities, right? And that they were largely ignored. It took a while for people to recognize that this was a real crisis in nursing homes. And one of my favorite articles about COVID was an op-ed by Dr. Aronson that said, it was a quote about, oh, COVID is only affecting older people. And then it was only with a question mark, right? That was kind of the approach at the beginning, as if older people don't matter. And I think disabled people have been seen much the same way, right? Both groups get kind of lumped together as being very separate. I was just looking for the final data on how many people with disabilities died of COVID in the US. What I found is that in England, about 6 of 10 people who have died from COVID-19 are disabled, which is horrendous. I could not find anything in the US, which is a disturbing sign of just the lack of data and the lack of reporting on disability. And I want to disclose that I have a disability myself. I'm in a wheelchair, and my respiratory function is affected. I have been terrified of getting COVID. Probably my partner has been more terrified than I have been. And I work with seniors. I work with people with disabilities. These are my communities. And I've been so worried about my friends, my neighbors, just, the impact on our community. The COVID pandemic is the most horrific manifestation of ableism and ageism that I think most of us have ever seen in our lifetimes. We've seen this crisis in nursing facilities, in other facilities for people with disabilities. We don't even know the toll. Older people and disabled people who rely on home attendants or family caregivers put themselves at risk of COVID every day that people came in and out of their homes. And I don't remember ever seeing this talked about widely. Then we dealt with the threat of care rationing. This idea that hospitals were so worried that they wouldn't have enough ventilators or enough ICU beds that they would have to decide who to treat. And very early on, it became clear that they were assuming that older people and people with disabilities would be low on the priority list. And they say this is about survival rates, but that's only part of it. I think we know, and we need to not sugarcoat the fact that this is about whose lives do we value, that seniors and people with disabilities are seen as less important and more expendable. There was a story that came out in Texas of a man named Michael Hickson, who was a Black disabled man. And he died of COVID, and he didn't need to. He was in the hospital, and a doctor suggested that they remove the ventilator because the doctor said he didn't have any quality of life because of his disability. This was a judgment call by a doctor, and many studies have shown that health professionals assume that disabled people have a lower quality of life than the disabled people themselves believe that they have. And it's no coincidence that the man was disabled and Black, right? 2 factors that led to a white male doctor, non-disabled doctor, making this judgment value about his life. So once hospitalizations decreased in parts of the country last fall, including much of California, there was a sense of people coming out and starting to do more again, but not those at highest risk for COVID. Many people in our communities who felt forgotten and isolated. It was this sense of, oh, young people can go out and do things, oh, maybe we'll get COVID, but maybe we'll be okay. For so many of us who knew that we might not be okay, that was not the narrative, right? In the November election, many people in nursing homes were disenfranchised because their facility was no longer a polling place and their family members or friends could not come help them vote or drop off their ballot. And not surprisingly, that especially affected poor people and people of color in nursing facilities. when the vaccines came, it brought hope for so many people. You know, other speakers have talked about, of course, that hope was, you know, varied based on race, as the vaccines came under the shadow of how the US medical establishment has so often treated Black and brown bodies. California had an advisory group on vaccines, and at one point they looked at vaccine prioritization as a binary. And I remember a PowerPoint slide that laid out saving the most lives, which meant focusing on seniors and people with disabilities, who were most of the people dying, versus, and I think they actually used the term versus, keeping society functioning, which would have meant focusing on vaccinating restaurant workers and other service workers so businesses could open again. Neither was about the actual lives being most affected. It was about businesses, it was about profit, it was about this idea of the economy, in quotes. So disabled people were low on the state's priority list, but they were on it. Caregivers and family members of people with developmental disabilities could actually get the vaccine before disabled people. And this also goes back to Jorge Macias's question, which I thought was just right on, that it was, okay, if you're a family member of a disabled person, then you should be vaccinated. But the actual disabled person is seen as so separate from society that they were not on the list. And then in late January, Governor Newsom decided that age would be the only factor for vaccine priority. And it was good for older people in general, but it did not take into account all the older people with chronic conditions who should have been first on the list, plus younger people with disabilities. And again, people of color are much more likely to have disabilities and chronic conditions.
So Jessica, I'm so sorry. I have to ask you to wrap up just
okay.
because of time. If you could just say your final.
I will wrap up. Yes. So there were a lot of problems with the vaccination system. It left out people in prisons, ICE detention centers, hugely disproportionate numbers of Black, Indigenous, people of color. It also required people to get a doctor to certify that they were at high risk, which again means you have a relationship with a doctor and you trust them and you think they trust you. It took months to get counties to set up programs to reach homebound people. So to wrap up, you know, we saw ageism and ableism exacerbated by racism at every turn, and this has to change. We have this huge opportunity before us. Through the pandemic, people got more of a peek into nursing facilities than ever before. And we saw that this horrendous death toll was not only because of people living together, but it was about chronic understaffing, lack of PPE, isolation, and the impact of private companies focused on profit in healthcare. We can push money out of nursing facilities and out of healthcare. We can talk more about home and community-based services so people can stay in their homes and their communities. We can value caregivers and attendants and make sure people are paid and treated well. Overall, we have to shift how we see disability and age. For media, we can find out what terms people with disabilities are using in their language. So we start to shift how we're talking about disability. What are the newer, more empowering words? And to talk to disabled people and seniors directly and share their voices and take all of these measures to really show that seniors and disabled people are an integral part of our society.
Thank you so much. I wish we had another hour to continue this, but let me say this is really the starting point, the first step. We intend to pay a lot more attention. I would like now, because people have been so generous, all our speakers have been responding to questions in the chat box. Please do continue to do that. In the interest of time, I'm going to ask each of our speakers, starting with Ms. Wade, in a 30 to 40-second soundbite, if you will, what is the most important step from your point of view moving forward to ensure seniors, homebound elders, people with disabilities are at the front of the queue that they're not left behind in this last phase of the vaccine rollout? What are the next steps you want to see done and that we as media need to be focused on? Could we start with you, Ms. Wade?
Yes, I have two big asks, which I hope lean into all that you do and your mission and your commitment. One, of course, is the ultimate news you can use, the information you share, the questions you answer, the myths you debunk over and over and over again is the ultimate news you can use, the news that saved lives. But more than that, I think you've heard today how much ageism and racism and ableism is behind some of these gaps. And what you do to center older adults and the voices of older adults and lift up their wisdom and their value. We are losing our culture, our history, our elders to this terrible, catastrophic pandemic. And I really am relying on communities of color to lift up older adults in ways that the dominant culture has failed to do. So I beg of you, if I can be so bold, to double down on what you know about the value of older adults in your cultures and your families and your communities and your traditions and your history keepers and culture keepers, and bring that to all of your stories, all of your coverage on this topic and everything that you do. And thank you for doing that already and really setting the pace for the mainstream media, quite frankly. You are the gold standard and I'm grateful to you for it.
Thank you. That's a tremendous call to action. Dr. Aronson, do you have a very short soundbite of what you advise us to look for as next steps?
I like what Kim just said, and I would just add, just because someone's in a position of authority in government, in medicine, somewhere else, doesn't mean they can't be ageist or racist or something else. So keep asking questions and keep putting the voices of the people we're trying to represent, help, and become in a certain number of years front and center, because you are the antidote to their invisibility.
Thank you. Annie Chung, your final words or thoughts for this morning's panel to our media partners, what you'd see us, what you would like to see us focus on as we expand coverage of elders, people with disabilities, and vaccines.
We have the senior stories. We could take you to them. So if any ethnic media partners and friends want to dive into this last 25% most vulnerable seniors need vaccination, then work with us and volunteer.
Thank you. Cindy Cox-Roman, I'm so sorry we didn't get to address questions. Several people remarked on how important the research you shared with us was. What is your next step? What do you want to see happen most?
Sandy, one thing I'd like to do actually is to focus on families and helping families talk about this. We're actually embarking on research to figure out how to help Black families come up with their own ideas and solutions for making it easier to have conversations, which are difficult for people in general. So that's a big focus of our attention. I just reiterate, listening to voices, not making assumptions. Thank you very much.
That as somebody who lives in a intergenerational household, you can be not alone, but you can be still alone and cut off as an elder. So I think that's an extremely valuable theme, extremely valuable focus. And finally, Jessica Lehman, thank you so much for your inspiring focus on people with disabilities. I think one of the important news we can use columns could be terms. You mentioned the importance of language and terms. What are some of the terms we should be using as we refer to seniors, people with disabilities, and homebound people? But you get the last word.
Oh, no pressure though. So people with disabilities, sometimes disabled people, definitely not the disabled. in Spanish, personas con discapacidades. I don't know what it is in other languages, but I can certainly connect you with disabled folks who are kind of, doing that work in different communities. So I can help connect you. I think to center and seniors, older adults, not the elderly, right? Really thinking about what do these terms mean, and as you center the stories of older people and people with disabilities, is showing people as people, right? Not as others who need to be cared for, not as helpless or frail. People may need physical or some other kind of help, but they have lives, they have stories, and we can share those. And as reporters, I think also when there is data that you can't find, right? When you're looking at the relationship between disability and age and race, for example, and you can't find that data, publicize that, right? To be able to say this doesn't exist, for people to see what's missing is sometimes as powerful as what you can share.
Thank you to all our speakers for a very inspiring hour. We're just putting that phone number on the screen as a final reminder of a number we can share. Ms. Wade, thank you so much for co-hosting and for bringing the Department of Aging directly into conversation with our media partners. There's some great ideas for initiatives in the chat, and we look forward to continuing this conversation. Our conference is now closed.